and then we'll go live. Welcome, everybody. We're going to give everybody just a couple more seconds to settle in, and then we'll get started. Well, great. Hello, friends and colleagues. Before we begin, I just want to run through a couple of really quick reminders and then turn it over to today's presenters to do all the heavy lifting. So for those who need it, this webinar offers American Sign Language and closed captioning. Our ASL interpreters will be spotlit throughout the presentations, and subtitles can be enabled by selecting the captioning icon on your toolbar. The session is being recorded, and the recording as well as the slides will be distributed via email and archived on the Collaborative's website. And more of a reminder for me to actually enable the chat, but we do have that available and encourage everyone to engage throughout today's webinar. Feel free to post your comments, your questions, reflections, resources, etc. We hope to have an open but courteous dialogue. And we'll also be following up presentations with a not so formal Q&A segment. So feel free to raise your hand and I can unmute your line. We'd love to hear from you directly, love to hear your voice. All right, and thanks, Nancy, for advancing. Today's agenda spans 2 different topics. So we'll spend about an hour with our colleagues at the State Council for Developmental Disabilities, learning about the council, learning about their work on addressing California's housing crisis, and about opportunities for partnership and collaboration. So as many of you may already know, this year the State Council partnered with a couple of collaborative member organizations, including Justice and Aging and Leading Age California, to sponsor AB 2547. And this was a bill that Assemblymember Nazarian carried forward that focused on housing stabilization to prevent and end homelessness among older and disabled adults. I know that many of you are really excited about this bill, and this was one that we highlighted in conversations with legislators and staff during our annual Advocacy Day event. We signed on letters of support on behalf of our membership. And despite all of those valiant advocacy efforts, AB 2547 did not move forward this year. But although we're really disappointed, I'm hoping that Bridget and Sheridan can give us a glimpse of what might be bubbling up for the next legislative cycle and how we might be able to plug in and support each other. And after that, I'll turn it over to Sam from Chapman Consulting to walk us through PATH funding. There is over 1.4 billion, and yes, that's billion with a B, in funding to support community-based organizations and providers as the state rolls out CalAIM and stands up community supports and enhanced care management. And under PATH, there are a number of opportunities that qualified entities could leverage. Sam will walk us through those, talk about criteria and timelines. And I know that navigating CalAIM and all the wraparound services and PATH, et cetera, can be hard to navigate. It's technical, there's lots of jargon, but I hope Sam can help us get a clearer picture. And if there is questions or a deeper dive that folks would like to see in the future, we'll see what we can do to coordinate that. So without further ado, I'd love to welcome Bridget and Sheridan.
Great, thank you so much for that. And hi, Collaborative members. We're really happy to be here with you today. And Bridget and I will give some brief introductions on each other here ourselves, and then we'll dive in. And we'll looking forward to having a great discussion with you all today. Bridget, do you want to kick off introductions?
Sure, thanks, Sheridan. My name is Bridget Kolakowski. I am the Deputy Director for Policy and Public Affairs State Council on Developmental Disabilities. I joined the council in February of last year. Very excited to work with the council and the community to improve our public policies. Before being at the council, I spent 15 years in the legislature, so my expertise comes from developing, negotiating, and successfully moving legislation. And very excited to bring those skill sets to the council and to all of the stakeholders that our intellectual and developmental disabilities community intersects with. Sheridan.
Awesome. Thank you. And Bridget, it's been so much fun working with you this last while. So I'm Sheridan Nicolau, everybody. I am a regional manager with the California State Council. I oversee the Bay Area region, and for our state plan work for California, our federally funded work that covers 5 counties. I'm involved in a variety of statewide projects as well. And we also cover about 10 counties for some state-specific funded projects. And prior to my time with the State Council, I come from the private sector, specifically nonprofit work, and did a lot of cross-disability organizing and advocacy work, as well as services for individuals from birth to death. So really glad to be here, and I'm familiar with and really admire a lot of the collaborative's partners. We've worked together in different ways over the years. Next slide, please. So here's what we'll do with you all with our short time together. So we'll talk a little bit more about the State Council on Developmental Disabilities for those that are less familiar with the State Council. We'll give an overview specifically, since today the interest was to talk about what we're doing in housing. So we'll give you a quick overview of our housing values and a bit about the advocacy work and policy work. We'll give some examples about what that's looked like in recent years. And then Bridget's going to dive into our 2021-22 Access and Inclusion Bill package. And she'll also talk about some other housing related bills that we're all watching and need to stay close to as we see them develop over time. And then she's going to give us some asks and some ways that we can all collaborate moving forward on our shared values and our shared interests around housing, as well as other areas that support aging adults and adults with disabilities. Next slide, please. So the role of the council. So for those of you that aren't familiar, we are established by state and federal law. We are independent and federally funded. And our mission is that we advocate and promote and implement policies and practices that achieve self-determination, independence, productivity, and inclusion in all aspects of community life for Californians with intellectual and developmental disabilities. And we'll be using the acronym IDD, Intellectual and Developmental Disabilities, as we talk. And just, for those of you that maybe are less familiar, when we're talking about developmental disabilities, we'll be talking about as defined by state of California, which means that's, disabilities that are more substantial, involving mental or physical impacts that manifest before the age of 18 and that are expected to continue indefinitely. And here in California, that includes categories of disabilities like cerebral palsy, epilepsy, autism, intellectual disabilities, and other conditions and disabilities that are closely related to intellectual disabilities and might benefit from similar supports. Next slide. So this is kind of high level, looking at our work at 3,000 feet here. And just to start, there's a state council in every state and US territory. For our focus here in California, we have about 40 million people, of course, as you know, in California. About 620 of those people here in California are people with IDD, with intellectual and developmental disabilities, as defined by the federal definition. And if we're looking at the California definition, meaning those that are eligible to receive developmental disability services here in California, that's really about half, give or take, of the amount of people that have IDD based on the federal definition. So people receiving IDD services here in California, that's at roughly 360,000 people. And then that's also including about, give or take, 130 to 150 people that are currently living in developmental centers. And so this work of ours is driven by what we call our state plan. And our state plan is a 5-year plan that we develop with months and months of direct community feedback and a lot of gap analysis and needs data from previous years' work with the community. And so our current 5-year plan, our focus is in several areas, but in a nutshell, we're looking to increase the number of people with developmental disabilities in the state that are strong self-advocates, that are peer trainers, that are community leaders and picking up their leadership in new ways to make impact. We're also working with community members to protect and enhance civil rights and to improve community-based systems to be more inclusive of people with developmental and other disabilities. And certainly when we're thinking about systems, we're thinking about especially things having to do with employment, having to do with education, having to do with housing, self-determination, health and health equity, as well as public safety. And then lastly, in our state plan, we're looking to leverage partnerships so that more people with developmental disabilities and their families know about their rights and can advocate for their own rights and the rights of others, especially when it comes to accessing supports and services for inclusion. And so we do all of this in what's easy to see as 3 buckets of work. And so the first bucket has to do with advocacy and technical assistance, systems navigation. The next bucket has to do with systems change or public policy. And the third has to do with building capacity, ensuring that we have greater strength and capacity in our community to accomplish these things together. Next slide. And then we won't go into details today. We have a lot of things we want to share with you, but we wanted to make sure that you had just the references for both the federal law and state law that the State Council is a part of. And so federally, we're a part of the Federal Developmental Disabilities Assistance and Bill of Rights Act. That's also the act that details the provision of all of the federal partners that take place in every state and U.S. territory. So that's protection and advocacy. Here in California, that's Disability Rights of California, state councils, and then the third partners are the UCEDS, the University Centers for Excellence in Developmental Disabilities. And so those partners are present in all of these states and U.S. territories. And then also the DD Act, as it's often called, also oversees and rolls out projects of national significance. Next slide. And here in California, the State Council, some of our role and our mandates are also held in the Lanterman Developmental Disabilities Act there. And for those of you that are less familiar, the Lanterman Act is established to protect and uphold the rights for services and supports for people with developmental disabilities, with the idea of these services and supports enable them to live more independent lives in their own communities, with the idea that everyone should have the opportunity to live in the community with the supports and services that they need for success. So really speaks to the individualized ways that we can support people live lives of their choosing. Next slide. And so we won't go into the structure in terms of our council, but I at least wanted to give you a rough understanding of, with our council, we have 31 governor-appointed voting members on the State Council. 20 of those are individuals. 20 of those are specifically non-agency people in the community that reflect the socioeconomic, the geographic, the disability, the racial, the ethnic, and language diversity of California. And those 20 of the 31 are people with developmental disabilities or their family members that live in California. So that's 20 of our 31. And then the remaining of those 31 council members are agency members. And so we have this and their logos up here. So that includes either a director or designee from California Health and Human Services, Department of Developmental Services, Department of Rehabilitation, Department of Education, Department of Healthcare Services, Department of Aging, as well as our federal partners, as mentioned earlier. So Disability Rights of California and the USEDS. And here in California, that's UC Davis, the Mind Institute. That's University of California, Los Angeles, the Tarjan Center, and University of California, Southern California in Children's Hospital. And then lastly, we have one governmental agency with the council, and that's the California Sibling Leadership Network. You can see on the bottom right-hand corner there. Next slide. Great. So that's a little bit about us. Let's dive into housing. So first, we wanted to share a little bit about our platform statement on housing. So here's the context, and many of you are very familiar with the context here, which is that many Californians with intellectual and developmental disabilities fall into an extremely low income category, living on minimum wage or fixed SSI, SSP income. So for many Californians with IDD, we're talking that their income is somewhere around $900 per month, give or take. And so, we know that the standard housing guidelines suggest that no more than 30% of one's income should go towards rent. And so for people that are living in this category that we discussed, that would be roughly, give or take, $300 a month for housing. Good luck finding that in California. We know how challenging that is. And so there's no surprise that a majority of adults with developmental disabilities here in California, they live with family or guardians, or they make it work with many folks living with family, whether or not they actually want to live with family. And in fact, there was a community survey a while back, and of the people with developmental disabilities who responded to the survey, about 85% of respondents say that they would like to live in their own place in the community, either with roommates or on their own, with whatever supports that they need. So 85% of people want to live independently in the community with whatever supports they need. But a majority, 60% plus of people live with family members because of lack of options. And so when we talk about options, just another way that we can frame this is we know that there's not a one size fits all. There never is for any community in California, right? And so when we think about housing advocacy and housing options, it's important that the key word here be diversity, right? We need diverse options to meet the needs of the community. So that covers all kinds of types of housing, including family homes and apartments and multifamily housing, ADUs, and a whole laundry list of different types of support services at different levels or different intensities or different frequencies that meet a person's individual needs. And so for our platform here, it's saying that if we consider the context and we consider the options, it's super important that living options for people with IDD have to be increased and have to be enhanced through access to housing and the subsidies to create that housing and to live in those housing that are paired in a timely manner with the needed supports and services. There's also that understanding of housing is one thing, supports and services are another. You want to keep that separate as much as possible because you want people to have choices of who and how somebody or people are supporting them in their preferred housing. And then housing, community education and integration have to be provided to reduce discrimination, and permanent, affordable, accessible, safe, and sustained housing has to be continually developed to meet both the current and future needs. And we'll talk a little bit more about future needs in a minute. Next slide, please. And so this is a little bit some excerpts of our policy priorities when it comes to housing. So again, it's about option and making sure that everybody has an option to live in the community, knowing that looks different for different people. The idea of permanent, affordable, accessible, safe, and sustained housing options have to be continually developed to meet the needs of a variety of disability populations, disabled communities, and aging communities. And that statewide inclusive living options for folks must be increased and enhanced. And again, that comes with the development of housing and then the subsidies to make sure that people can afford them. Next slide. And so there's a couple of ways that we work towards this with our housing priorities. One is to work on policy recommendations that are in the strategic framework, statewide strategic framework, and we're going to talk about that. That's a framework for housing that was developed through state council funding, and it was developed by the Lanterman Housing Alliance, which is a statewide collaborative of nonprofit organizations, also for-profit partners and affiliates, all focused on improving housing options. We'll talk more in a bit. And then that second part there is speaking to our earlier point, which is making sure that we have dedicated housing funds and housing funding streams to support integrated community housing for people with developmental disabilities. All right, next slide, please. So before kicking it to Bridget, I wanted to talk a little bit about, here's some examples of what that looks like. So remember, we talked about the 3 buckets of work that the State Council does. So within each of those buckets, I wanted to give you a few examples. So if we're talking about advocacy, so, that's looking at how do we, it's looking at a few areas of focus, how do we, decrease the barriers for housing for people with developmental disabilities? How do we ensure that people have the tools and the information and the connections to be able to lead advocacy efforts for themselves and for others? And just some examples here. In 2021, this last year, we provided about 140 technical assistance cases in the areas of housing access, housing discrimination, and housing capacity or building development. Also, last year, we supported and we collaborated in about a little over 40, I think it was 41 community meetings on housing. And we provided another about 12 trainings so that community members were better prepared to get involved in housing advocacy, either to address their own housing needs or generally the needs of the community. And some of those trainings were in partnership with other housing rights entities, including, there's a whole laundry list. We won't go into all of our amazing partners, but we happened to, in this last year, do a fair amount of work with the Department of Fair Employment and Housing, now known as California Civil Rights Department. So that's just one example of how we partner. And in total, we directly connected with or trained or supported directly about 1,400 Californians in housing-related advocacy work. And we sent resources and information on housing rights and housing resources to tens of thousands more over this last year. And that's both to professionals in the field, that's for people with developmental disabilities and other disabilities, cross disabilities, aging populations, and that's also for family advocates too. Next slide. So in looking at capacity building, I was thinking about what are some examples that we can share. One of which is, we're really proud to have year-round sponsorships and annual grants that we can provide to community partners that share our goals for a variety of our state plan focuses, including housing. Our current grant cycle 45, right now is in the protest period. So we have that posted on our website. And, if all of those proposed selected projects make it through protest period, then they will be awarded that funding and they can get started in the fall. And so there's actually 4 projects right now that are in their protest period. We're really excited about all of them. But one of them currently, what they're looking to do is they're looking to increase access to plain language housing resources, including common forms used in low-income housing rentals. And then from there, after putting together all those plain language resources, the project would commit to would look for certain projects in California that would adopt and use those plain language housing forms. And then we would be the agency would then work with partners to provide training for housing owners and property managers on those plain language forms and lessons learned. So we're pretty excited about that. And if we look back a few years at our grant cycles, several grant cycles ago, we funded the Lanterman Housing Alliance to produce the report that we mentioned earlier, which is the statewide strategic framework for expanding housing for people with developmental disabilities. So that was released back in 2018. And what that report is, it's available for folks to take a look at, and we can send that out later if that's of interest to people. It was written from the viewpoint of affordable housing and community development sectors, and looking, involving a wide range of public policy and finance and development stakeholders. And it did a few things. It talked about the resources to address the need, housing models that include low-income housing tax credits, that include set-asides, use of rental assistance or operating subsidies, and housing transition services. This framework also talked about lessons learned, including lessons learned from other underserved populations, including how best to utilize services through different systems like regional center systems, how to leverage capital funding through state and local agencies, including, community development block grants, low-income housing tax credits, those kinds of things, as well as the operating subsidies. So everything from housing choice vouchers, project rental assistance program, mainstream vouchers, that kind of thing. And then the framework also talks about initiatives that it recommends moving forward, and kind of helps identify that need and pinpoints the strategies that would work. And this report actually estimated that the number of needed supported housing units in California we need more than 20,000 housing units than we have now, just to begin to meet the needs. And this was back in 2018. So we know that the need is much greater because the rate of housing development hasn't kept up with current demand, much less future projected needs. So we definitely recommend you take a look at that report. And lastly, before we move on, I wanted to mention that internally at the State Council, we have a subject matter expert working group. And that internal working group that's dedicated to housing work and advocacy, they're focusing on developing some on-demand learning videos where anybody can log on anytime, day or night, and can catch webinars on fair housing rights, housing advocacy, or housing development. We're pretty excited about that. So that's another example of what we're working on for capacity building. Next slide. And lastly, just wanted to give a little bit of examples about systems change work. Okay, so I was thinking about the last year or two, what are some examples of systems change work specific to housing? So as a result of not just our advocacy, but the advocacy of so many organized advocacy agencies, like many collaborative members, individual activists and constituents, the California Tax Credit Allocation Committee, TCAC, staff withdrew. Remember this back in 2020, staff withdrew their proposed changes to reduce the number of required accessible units for new projects. So the background on this is, over 4 million Californians have disabilities and needed accessible housing. That was a well-known stat, and close to 75% of California's housing stock, we know, has been built before accessibility requirements were adopted back in the 90s. So because there are so few units of accessible housing, there's a lot of Californians with disabilities of all kinds that unfortunately are more segregated, not able to find housing in their own communities. And so the Tax Credit Allocation Committee, TCAC, they fund one of the state's largest affordable housing development programs, as many of you know. And historically, that program required at least 10% of units to include mobility accessible features, and at least 4% of those units to include hearing and vision accessible features, even though the percentage of people that needed those features was much, much larger than that amount. And so when TCAC proposed cutting those accessible housing requirements in half, the community came out in force. And so for us at the State Council, we submitted a letter with comments from 127 organizations and 340 something individuals to say, not only should you not cut, but you need to increase. You need to increase the minimum percentage requirements for accessible units. That letter contained a bunch of stories, I think over 130 stories regarding the need for affordable housing, accessible housing for people with developmental and other disabilities. And, this is just one of those examples of everybody working together, right? Partnerships coming together in full force, because what happened was TCAC withdrew the draft to decrease their minimum percentage. and replaced it with the proposal we have today, which some of you are familiar with, which is much higher levels. So the minimum is 15% for mobility accessible units and 10% for hearing and vision accessible units. And that kicked off this last fall. So very exciting. A much smaller example before I turn it over to Bridget would be, just looking at a community on the California coast here. As we know, on the coast, housing is in very short supply in all areas of the state. One of our colleagues, the state council, one of the regional offices, supported working with local advocates to kind of build up their strength and their voice around affordable housing. And that, in addition to a letter from the state council, was published in the local paper. And the community reacted, planning committee reacted from that and approved a housing development plan that included accessible units with some set-asides for folks with disabilities. So those are just a couple of examples. There's so many more, but Bridget, tell us about what's going on with both the current bill package and then what's coming in the future. Over to you.
Excellent. Thank you, Sheridan. That was a ton of information. Thank you for sharing it with everybody. I think even I learned a few things, but we've got a lot, and I don't want to spend too much time talking about some of these fairly complex bills and policies that we are prioritizing, but I did want to give you all a flavor of what we're working on and how we're shaping our legislative efforts. So for the year of 2022, we sponsored or co-sponsored 4 bills. These bills all lend to the same theme of access and inclusion. And I've got them listed here. I'll also walk through each one very shortly with a brief update on the current status of that bill. You'll see that one of the bills is a housing item, and several of the bills speak to both the disabilities community and the aging community. Next slide. SB 1092 is a bill by Senator Hurtado. This is fair hearing reform. And the current status of this bill is it passed. About 80% of what was in SB 1092 was put into the state's budget and will be rolling out the reforms for fair hearings. What is happening is regional centers allow for fair hearing when there is an objection or an appeal to a decision that had been made prior. And the point of the bill is to make sure that these fair hearings are truly fair, to make sure that they are transparent, and to make sure that both family members and self-advocates are able to participate in the fair hearing process. That has not been the case to date. The next step for this bill is, because most of it passed into law by way of the budget, we are going to be implementing, DDS will be implementing the changes. The council will be observing the implementation stages to make sure that what was intended in the bill is what's happening in real time. And if it's not happening, we're just going to bring our observations together and decide what needs to be done. Do we need clarifying legislation? Do we need clarifying regulation? Is it just a matter of giving the courts and the administrative law judges and DDS time to figure out the changes? Okay, next bill. AB 1663 by Assemblymember Main Shine reformed probate conservatorships. The people who use probate conservatorships the most are individuals with disabilities and our aging population with dementia and Alzheimer's. We partnered up with Leading Age and several other entities on this bill. Sorry, we did not partner up with Leading Age on this bill, but we had a very large coalition, which does include the Alzheimer's Association. Currently, the bill is sitting on the governor's desk, and we hope and expect that it will get signed by the end of the month. Also, in AB 179, which was the last budget bill that passed at the end of session this year, there's a $5 million appropriation that comes to the council to manage the supported decision-making technical assistance program. So one of the most incredible things about AB 1663 is it puts into statute supported decision-making. This is the first time we've been able to do that in California. I think we're one of many states now, possibly 20 states have supported decision-making in some form in their statute. The next step for this is we have to make sure that the governor signs AB 179 and AB 1663 and doesn't change or get rid of the funding appropriation. If everything is a green light, then we will be implementing the supported decision-making technical assistance program in coordination with Disability Rights California that Sheridan talked to you about, and with the UC Davis Mind Institute, the other you said. So we will be working in full partnership and coordination with them to make sure that there's a consistent and appropriate and helpful series of trainings and materials available for anyone who is interested in learning how to use supported decision-making. Next slide. AB 2547, thank you all for your support and advocacy on this incredibly important bill. So important. And it's your good work that I think is the reason why the bill made it as far as it did. AB 2547 appropriated $1.3 billion to housing subsidies, dollars that would go directly to our family members. Usually a bill that large would never get out of the first fiscal committee, that especially if it's not funded in the budget. This bill was not funded in the budget, unfortunately, but both the Assembly and the Senate expressed enough support that it passed out of the Assembly, it moved into the Senate, it passed the Senate Policy Committee, and we held it in the Appropriations Committee, only because there wasn't a budget appropriation. But while the bill didn't make it, it is an indication how far it got, how much support we really have, not just from organizations and entities across the state, but inside the legislature, ranging from rank and file legislative members all the way up to leadership and staff that work on housing priorities for both the Senate Pro Tem and the Speaker, the Assembly Speaker. So what's next on this bill? We, as the coalition, are meeting regularly every week to talk about how we can make this a success next year. Part of that challenge is finding the right department who will be able to be in charge of the subsidies and the grants. It's a pretty big project, and there are a couple of agencies that we think it would be a good fit. There's housing and community development, there's aging, but we are going to meet with the departments, we're going to meet with the leadership, we're going to meet with the governor's office and figure out what is the best way to move forward. That might end up changing what the bill looks like. It might end up reducing the amount of money that is being appropriated. But regardless, the coalition is committed to trying to introduce another bill next year. So we will certainly keep you all posted. Of course, we have to figure out what we're going to do, and then we have to find the right champion, because Assemblymember Nazarian is not coming back. So we're going to need a new legislator, whether it's an assembly member or a senator. We welcome hints or recommendations from you all. Okay, next slide. AB 2920 is by Assemblymember Ramdula. This is an inclusive college. It simply provided $10 million to University of California and to California State University campuses to expand or create an inclusive program, which brings in our IDD population for a complete 4-year education. It's not just a short-term or a temporary program. The idea is to integrate our students into college life, into campus life, and to go through the entire process of the 4-year education, and then hopefully graduating and getting a diploma. This coalition is also dedicated to trying to reintroduce this bill next year. We'll keep you all posted because it's never too late to go back to college. All right, next slide. So I don't want to spend a lot of time talking about bills that you all might already know about, or about issues that you are only sort of interested in. So I have here a few slides with examples of big bills related to housing. I can run through them, but I wanted to pause really quick and see how we're doing on time, and to see if maybe we want to stop for questions. Maria, would that be your call?
I suppose it would, Bridget. I'm really interested in hearing about these bills, and I know that we're getting close on time, but I welcome other attendees that are with us today to drop in the chat how they feel about walking through these, but I'm definitely in support. And I think if we can run through them and maybe have a shorter Q&A, that would work for me.
Great, that's perfect. I'm happy to do it that way. Because I am the policy director for the state council, I do not have expertise in these bills, but I thought these are very important. They are still moving. They're all pending a signature on the governor's desk. So I wanted to bring them to your attention. SB 6 by Senator Caballero is related to commercial zoning. This bill is the Middle Class Housing Act of 2022, and it establishes housing as an allowable use on any parcel that is zoned for office or retail uses. This project sizes are limited to 20 acres, and it does not include any affordability requirements, unfortunately. And if the bill were to get signed into law, the program would sunset in 2033. So there are elements of this bill that are both amazing and not amazing. Ultimately, we need more housing stock in the state. That's part of the reason why housing is so expensive. The council and our community and our advocates obviously would prioritize affordability. We obviously would prioritize accessibility. But lacking those items, a project like this could help significantly in creating more flexibility, more housing, and hopefully reducing the cost of housing over time. Next bill, please. Sorry, slide. AB 2011 is by Assembly Member Wicks. This is the Affordable Housing and High Roads Job Act of 2022. This is a great example of how to be creative in legislation, because while the bill creates a streamlined approval process for 100% affordable housing projects in commercial zones and mixed income housing projects on commercial corridors, it also requires labor standards on those projects, including prevailing wages, apprenticeship programs, and special healthcare expenditures. That is a collaboration of housing advocates and labor. There is a lot of intersectionality, and it's the power of labor along with the power of housing advocates is how you get to this, this stage on a really important bill. And this underscores why we think we have a lot in common with you all. Next slide. AB 2817 is by Assemblymember Reyes. This is the Housing California Challenge program. It establishes the House California Challenge program to provide direct rental assistance to help persons experiencing homelessness to obtain housing. This is very similar to AB 2547 in that we're talking about basically a voucher or a subsidy. But the creative piece that Reyes did here is it's not funded. It just creates this shell of a program under Health and Human Services Agency and upon appropriation. So we'll see, maybe the governor will sign it as an unfunded optional project for Health and Human Services Agency, or maybe he'll veto it because dollars are not appropriated yet. We'll see. Next slide. There we go. Got through that very quick. This is the power partnerships. I've been underscoring it with the bills that we worked on. We worked on education. So the state council is collaborating with advocates in the education universe and in the college, the Think College education universe. We collaborated with labor. We've collaborated with our aging communities. We've collaborated with the housing communities. And it's by bringing us all together that we can actually make really incredible progress in public policy. Our population is under 1 million folks in a very large state. We matter, we're big, but we're not nearly as big as the larger aging community. But there are so many intersectionalities. We intersect at every stage in life. And it just makes perfect sense because I feel like a lot of our talking points are fully aligned with the aging community. Working in silos creates a this or that. It creates the feeling of a false option. Silos push people against each other, whereas collaboration brings us all to the table fighting in the same direction for the same thing. And it makes a difference. When I was working in the legislature, I would welcome large coalitions. And the whole goal of a large coalition is to steer in the same direction at the same speed. And it's doable. We all identify our bottom line. We all identify our ideal pie in the sky priorities. And then we all agree at the same time as we move through the legislative process what we can or what we cannot tolerate for changes to our priorities. A lot of folks get nervous about coalitions, but they bring so much muscle to the table. And no governor, no legislator can say no to a table full of advocates who cross multiple categories and are asking for the same thing. And just one note, because I understand you were disappointed about AB 2547 failing, it takes time. So we have to run these bills over and over again because we are educating legislators and staff. This year is an election year. 30% of the legislators are going to leave, which means their staff is going to move on as well. It also means we have new members and new staff that we have to re-educate. So just because something doesn't pass on the first year or the second year or the third year doesn't mean that we're not going to get it. I was legislative director for Senator Holly Mitchell. She ran the maximum family grant proposal 6 years in a row, and she got it on the 6th year. So that's just one example of how important it is to be patient and tenacious. I can wrap it up here and share it, and I think you might have some thoughts on this last slide.
No, I think you hit home. Thank you
Great.
so much, Bridget. These last couple of slides that you all will see is just contact information, right? There's no partnership without connection. So we wanted to make sure you knew, in addition to our headquarters up in Sacramento, we have 12 regional offices of the State Council. And if you are a collaborative member who is focused on regional issues, in addition to your statewide policy work, reach out. We would love to hear from you. Reach out to your local State Council office that serves your region or your counties of interest. And we'd love to find ways that we can work together, both for statewide impact and for regional and local impact. Next slide. And there you go. There's just some general info, our website, council email, how to connect with us on social, and direct contact information for Bridget and for myself. Thanks, everyone.
Wow, I am so impressed with the work that you all do. Today's presentation was elevating. Just excited to roll up sleeves and get to work. And Bridget, your comments about partnership and collaboration just ring so near and dear to the collaboratives approach, what it always has been, what will continue to be in the future. That was amazing. And I really appreciate kind of the underscoring that it's not just housing that we need in California, but it's accessible housing. I know that that's a theme that's been circulating for a while, but I think having, saying it over and over, one of these days that point will get across, not just housing, but accessible housing. So I want to turn to Q&A and see if folks have questions. Nina, I saw you had your hand up for a while, so I want to see if you still have a question. I'm going to just open your line and you can jump in if you'd like to say anything. Otherwise, we'll look at the chat and the Q&A. Lots of positive feedback.
I'm here.
Go ahead, Nina.
So really good to hear we're talking about 2547. We're bringing that back. ARP was very focused on that. We also supported 1663 and SB6 and AB 2011 were priorities. But getting to why I raised my hand, this is more Nina raising her hand. Our son is on the spectrum, and I wasn't aware there was a regional availability. So it's challenging finding services for him that really fit his need. So I can say thank you for sharing this wealth of knowledge with us today.
Thank you so much. Anybody else have questions or comments? Just a comment from Sherry in the chat. Excellent presentation and more importantly, excellent policy and budget advocacy work. Really appreciate your inclusive work and partnerships with the greater disability and aging communities. Thank you so much, Sherry. See if there's anything else, and if not, we'll turn to our next presentation. Yeah, I did hear you both mention that there was some resources available. There was a report that you mentioned that talks about housing demand and supply and goes into details on that, that there are webinars happening on housing rights. And so I'm wondering if you're able to share those resources in the chat. We can certainly circulate them as the post-webinar, part of the post-webinar package, and make sure folks have that at their fingertips. And of course, the regional list of offices will be circulated as well. So Nina, you can have that contact information, and anybody else who's working at that local level and might want to reach out as they're thinking about age and disability friendly planning at the local level. I was going to ask you both to talk about the intersection of older adults and developmentally disabled adults, but I think that was well covered. But I do still want to ask, what is it that you feel are some of the big takeaways for aging advocates? What is it that they can learn from the state council or from the DD population? Any reflections on that?
If I could just start, because I have a little teeny tiny comment, and then I'll volley it over to Sheridan. The aging nexus for us, one very distinct example is some of our population is prone to dementia and Alzheimer's. One example is Down syndrome. I like to point that out because a lot of people don't realize Down syndrome, individuals with Down syndrome didn't used to live as long as they are starting to live now. And I believe the propensity is upwards of 90%. So as they approach age late 30s, 40s, early 50s, that's when dementia starts to set in. So that's an example of an intersectionality that is very acute. And the fact that it's impossible for us to be able to live by ourselves independently in the community. So we do live with family members, and frequently it's our parents, and our parents are aging. And as our parents age and either pass on or go into supported living, there is, what do we do with our IDD children? So it's incredibly important, because not only are we aging and living longer and coming across a lot of conditions and experiences that other aging people have, but our caretakers are aging. And we don't have as much, while we are an entitlement community, we do not have the resources to be independent and to receive all the services that we actually need. So Sheridan, did you want to weigh in on that?
Yeah. Thank you, Bridget. Completely agree, and Joe, with everything that you said. You know, when I think of aging communities and developmental disability communities, a couple things come to mind, which is both communities have a lot to teach others when it comes to access and universal design, and knowing that when we build and create and manifest systems and structure and tools that that are as usable and accessible to as many people as possible, regardless of age or ability or circumstance, that's equity in its finest. And so the lessons that aging populations and disability populations intrinsically know about access and universal design, that makes the world better for all of us. So that's one. And the next is that aging communities and disability communities both know what it's like to have to struggle to make their leadership known and heard, right? Both populations understand, and of course the intersected populations understand what it's like to experience both institutional and direct discrimination, ageism and ableism. And what that means is that over time, we see that both communities experience more isolation and segregation, and their voices and their lessons and the leadership they have to give are not being heard. And so those are some things that we have in common and that we can leverage to make sure that that power is picked up, that power is heard, and that power is acted on to create a structure that's better for everybody, a world that's better for all of us.
That's amazing, amazing. And thank you so much for plugging in that equity perspective and talking about that, because I think it's so important to elevate as we have these conversations. So we learned how vast the council's work is, how important it is. I think I, for one, am feeling really inspired. Thank you so much for your time. And I hope that we can welcome you all back soon to talk about coordinated dementia care. I'm really glad Bridget brought it up, because I had a PowerPoint skim past my inbox, and when I opened it up and looked at the numbers of developmentally disabled older adults that have dementia, that 90%, I mean, that's just staggering. And it makes a really solid case for this collaboration that we talked about, underscored, you know, and I think we'd love to have you back to kind of talk a little bit more about that and see if there are ways that we can collaborate on that as well.
Let's do it.
I love it. Thank you both so much. And look at that, we actually finished right on time. Thank you. Okay, I'm not going to do a very big introduction for Sam. I think she probably knows this PATH stuff and CalAIM stuff like the back of her hand. I'm not as versed, so I always lean on Athena and Sam to help me stay in the loop, help me kind of navigate through what's happening. So Sam, I would love to welcome you up here and then just let you do the heavy lifting at this point.
Great. Well, hi, everybody. My name is Samantha Payon. I'm Policy Director with Chapman Consulting. And first, just a quick shout out and thank you to the collaborative for inviting me here to talk at a high level about the Providing Access and Transforming Health initiative that is being rolled out by the Department of Healthcare Services. PATH is a 5-year Medi-Cal initiative that is building up the capacity and infrastructure of on-the-ground partners. And I think that part is really key, that it's really truly aimed at on-the-ground partners, such as community-based organizations, to participate in the Medi-Cal delivery system as the state implements CalAIM and specifically enhanced care management and community supports. I would also just state too, I think there's a lot of really great information out there on PATH and the funding opportunities that are available. So if nothing else, hopefully this presentation will help to direct you to some of those resources if you need additional information. All right, next slide. Great. So today we'll be covering some information about enhanced care management and community supports and how they relate to the PATH funding initiatives. Covering, of course, what is PATH, and then talking more specifically about the various program initiatives and associated timelines. And then we just gonna have some time at the end for a Q&A discussion. Next slide, please. All right, so starting first with enhanced care management and community supports. Just to level set first, I thought about including a slide here on CalAIM. And I'm sure many of you are familiar with CalAIM, so I won't belabor this too much, but I would just briefly state CalAIM is a broad multi-year initiative led by the administration and the Department of Healthcare Services to improve the quality of life and health outcomes of the state's population. And they're doing that by implementing broad delivery system, program, and payment reforms across the Medi-Cal program. And so the goal really is to shift Medi-Cal to more of a population health approach, prioritizing prevention, addressing some of the social drivers of health and social determinants of health, and transforming services for communities that may be under-resourced or underserved. Now, there are specific CalAIM initiatives and services that will be implemented or are being implemented through CalAIM, but for purposes of this presentation today on PATH funding, these will be focused on enhanced care management and community supports. Next slide, please. All right, so what is ECM or enhanced care management? And it's one of the components of CalAIM, as I mentioned, and it's a new statewide Medi-Cal benefit that is available to select populations of focus. And it seeks to address the clinical and non-clinical needs of some of the highest need enrollees through intensive coordination of services and services including health and health-related services. The intention of ECM is really to meet Medi-Cal beneficiaries wherever they are, whether that's in the street, in a shelter, in the doctor's office, or in their home. Beneficiaries will have a single lead care manager who is responsible for coordinating their care and services among the various delivery systems. So hopefully with the goal of making it easier for them to get the right care at the right time. Next slide, please. So I know this is a little bit of a busy slide, but just really wanted to highlight the implementation timeline so you can see kind of the phased-in approach that the state has taken when implementing and extending Medi-Cal benefits to different populations of focus. So there is eligibility criteria associated with each population of focus and who are eligible to receive ECM services, and they extend through next year. So beginning with this year on January 1st, 2022, ECM went live in 25 counties across the state, in counties that previously participated in whole person care or health home programs. And so about approximately 95,000 Medi-Cal enrollees were eligible for and automatically transitioned into ECM in January of this year. Now, since January, new ECM enrollees have been served in those counties if they are also high utilizer adults, individuals with families experiencing homelessness, and adults with serious mental illness and or substance use disorder. The same extensions will also occur in already occurred in July of this year. ECM went live across the state, and so also these same populations of focus in the remaining counties were eligible to receive ECM services. And so looking forward in January of next year, ECM will extend to 2 additional populations of focus, which includes those at risk for institutionalization and eligible for long-term care, as well as nursing facility residents transitioning to the community. And then lastly, ECM will go live for the remaining populations for all other children and youth. Next slide, please. So community supports are, shifting gears from ECM, community supports are another component of CalAIM that will be integrated with care management and ECM for members, again, who are at those highest levels of risk. And it allows Medi-Cal managed care plans to address social determinants of health in a way that is intended to be cost-effective and consistent with whole person care. And so DHCS encourages Medi-Cal managed care plans to elect to offer as many of the pre-approved community supports as possible. And those services are available to eligible Medi-Cal members, regardless of whether they qualify for ECM services or not. Next slide, please. So there are 14 pre-approved DHCS community support services that may be offered and are designed to address these social drivers of health. And I did say that Medi-Cal managed care plans may elect to offer these community supports. So it is an election, and they may do so every 6 months. There's a link to the DHCS website, which has the community support offerings by managed care plan and county, and it's updated as of June of this year. I'm actually going to put that in the chat because I think it's a helpful reference. Next slide, please. So I just wanted to also, since we're talking about ECM and community supports, also just include an introductory slide on the CalAIM incentive payment program, because it is also a funding opportunity that is incentivizing implementation and expansion of ECM and community supports. And there is some scope overlap with PATH, but it is intended to be complementary to PATH. So for time purposes, I won't read through all these bullet points. There's also another slide later in the presentation that we cover some of the differentiating mechanisms between the IPP funding and the PATH funding. Next slide, please. All right, so finally getting into the reason for this presentation, talking more about PATH funding. Next slide, please. So it is a Medi-Cal initiative. We know, again, it's supporting implementation of enhanced care management, community supports. There is, as Maria mentioned earlier, about $1.44 billion. So this is a lot of money that they've authorized for PATH funding. And they're also currently, the state is seeking additional money to support implementation of some of the justice involved initiatives. PATH funding is intended to complement and enhance some of the other funding efforts. So the IPP program that I mentioned before, and DHCS has specified that it should not serve as a primary source of funding for organizations. Several months ago, the state DHCS did announce that they have selected and contracted with a third-party administrator, Public Consulting Group, and so they are the contracted TPA who will be managing PATH activities. Next slide, please. So there are several initiatives within PATH that support implementation of ECM and community supports. And I'll just briefly say a few words about each one of them, but for purposes of this presentation, we're mostly and primarily focused on the initiatives that are labeled 2 through 4. So starting first with Whole Person Care Services and Transition to Managed Care Mitigation Initiative. And so this is funding that is specific to former whole person care lead entities, so counties. And they serve as a way to transition services until there's a transition to managed care. So the funding has already begun in January 1st of this year, and it will end by January 1st of 2024. The next initiative is a collaborative planning and implementation initiative, and it will fund regional collaborative planning and implementation efforts to promote CalAIM readiness. There's also the Cited Initiative, and the Cited Initiative supports the delivery of ECM and community support services, and it does specify that entities that are contracted or plan to contract with a managed care plan can apply to receive this funding. Lastly, there is a Technical Assistance Marketplace Initiative, which is providing off-the-shelf resources, a virtual marketplace, so to speak, to offer technical assistance from vendors to some of the organizations who are implementing and scaling up ECM and community supports. And then I think I mentioned just briefly, there is a justice involved capacity building also area that is being funded by PATH. And it is funding to support collaborative planning and infrastructure needs around some of the various statewide CalAIM justice involved initiatives. And so the application process is ongoing, and funding is also being dispersed currently. Next slide. All right, so honing in on those three initiatives that may be most relevant to this group, starting with the Collaborative Planning and Implementation Initiative. And so the third-party administrator, the TPA, is working with or will work with stakeholders in regions or by county to convene county and regional collaborative planning groups. And so stakeholders in stakeholders in a region will form these groups to work together to discuss, identify, and hopefully resolve implementation issues that arise with ECM and community supports. Excuse me. Each PATH collaborative planning group will have a designated facilitator that is responsible for managing the program, managing those activities, and regularly convening these collaborative planning groups. And so funding will be dispersed to a designated collaborative planning facilitator in each county or region. And that amount will be determined by the number and size of those groups. And so currently DHCS is in the process of reviewing applications for these collaborative planning group facilitators and will be matching those approved facilitators to counties based upon local needs and stakeholder input. Next slide, please. So collaborative planning groups will include multiple entities, and these entities are eligible and strongly encouraged to participate. And they really encourage participation from managed care plans, county, city, local government agencies, county and community-based providers, CBOs, tribal entities, and others as approved to DHCS. And they're hoping that some of the funding activities or some of the collaborative planning activities that will occur will be really, identifying some of the needs and gaps within the community, identifying, resolving local implementation issues, and then also monitoring how the PATH funds are being used and reporting on those uses of funds. Next slide, please. So they have released several resources that are pretty thorough. There is a guidance document at the website that is provided at the bottom there, where you can obtain more information on a number of different specific uses of funding, activities, information on facilitators and participants, the role of managed care plans in these collaborative planning groups, as well as oversight. And DHCS and the TPA has now opened up the opportunity to register to participate in a collaborative planning group. You may participate in more than one collaborative planning group. So I would encourage those to visit the website that is listed here for more information and to register. And you may also email the TPA directly if you have any questions on this initiative. All right, next slide. So the cited initiative, so one of the other PATH program initiatives is a grant program that is focused on, scaling and encouraging the uptake of ECM and community supports, specifically around capacity and infrastructure needs. So there is applicant criteria in the guidance document, but I think it's really important to specify here that cited applicants must be actively contracted with a managed care plan, county, delegated provider, or other entity authorized to contract with the applicant for the provision of enhanced care management and community supports. They also say you could also indicate through a signed attestation that you intend to contract with these entities in a timely manner. So that is also an option too. And so this particular initiative seems to be mostly aimed at organizations who have participating in some form or another in service delivery or intend to participate in service delivery of ECM and community supports. There are applicants who are eligible to receive funding, and they have several examples here, include county, city, and local government, public hospitals, CBOs, tribal entities, and others as approved by DHCS. Next slide, please. So some of the sample uses of funding that can support these organizations or cited applicants is to use it to increase the provider workforce. So that may include doing an assessment of current organizational capabilities, infrastructure, and systems, modifying, purchasing, and or developing necessary clinical referral, billing, data reporting, or other infrastructure and IT systems. So for example, supporting health information exchange between entities who are delivering or providing ECM and community supports, providing upfront funding needed to support capacity and infrastructure necessary to deliver ECM and community supports. For example, this could include purchasing hardware or office equipment, and evaluating and monitoring service capacity to assess gaps and identifying strategies to address gaps. And this could include the staff time taken to evaluating and monitoring these gaps, potentially through like a community needs assessment. And then also developing a plan to conduct outreach to populations who have traditionally been under-resourced and are underserved to engage them in ECM and community supports. Next slide, please. So there is minimum eligibility criteria, and the guidance document does a good job of specifying what that eligibility criteria is. In order to be considered an applicant or considered for funding, you must submit a completed application. You must demonstrate that funding will only be spent on permitted uses, that it is reasonable, and that your organization is financially solvent. You must show that there is alignment with the goals of CalAIM. And again, as I mentioned before, you must have an existing contract to provide ECM or community supports or attest that you intend to provide such. So currently, round one of the grant application period is open. And it will close on September 30th, and you can obtain information and access the portal at that website that is listed there. I will also state that cited funding will include multiple open application windows in each year, at a minimum semi-annually. So there will be, if you're not able to make the first round one, there will be another opportunity to also apply for the grant funding. And the state has also indicated too that applicants who may not or who did not receive an award during the first application window will be encouraged to reapply in the forthcoming round two application window. Next slide. All right, so this is, as I mentioned, the guidance document is pretty thorough and has some really great information in there that will help you if as you're thinking about or pondering or going through the steps of completing an application. Also, the TPA is offering direct technical assistance support for those who may complete a cited application. And so I've included their email, I've included their phone number. And then also, if you aren't yet webinared out for the day, right after this meeting at 2:30, DHCS and the TPA are hosting an information session on cited funding. So I will put that link in the chat as well if folks are interested in attending that. All right, so next slide, please. So the last initiative that I'll mention is called the Technical Assistance Marketplace Initiative, and it will offer resources for providers, CBOs, county agencies, and others through a TA marketplace. The application process and funding won't begin until January of next year, and the TPA will be contracting with other vendors to provide these services. For time purposes, I won't read through these listed domains or activities, but I do anticipate that more information on this initiative will be forthcoming as we get closer to the go live date. Next slide. So this is just a high-level timeline of the path initiatives that I've discussed today. Both the registration and application windows are open for the collaborative planning and cited initiative, as I mentioned prior. DHCS anticipates dispersing funding this month for the collaboratives, while December has been targeted for disbursement of funds for round one of the cited initiative. And then again, just mentioning that the TA marketplace won't launch until January of next year. Next slide. So I did mention at the beginning of the presentation the incentive payment program, and I thought it would just be helpful to quickly point out some key differences between the PATH program and the incentive, the IPP program. And you can see they both do have, like I mentioned, a little bit of overlap in that they support development of ECM community supports, infrastructure, and capacity building. While the PATH funding will support more of those technical assistance needs and other gaps that are not addressed by the IPP. And then also, I think a differentiating distinction between the PATH and IPP funding are who are the entities that are eligible for this funding. So for PATH, it includes all these organizations or entities who are listed here, but does specify that managed care plans are not permitted to receive PATH funding for infrastructure, capacity, or services, whereas the IPP program is directed to incentivize managed care plans who choose to participate in the program. And then finally, I would just state too, and I think I mentioned this earlier, the PATH funding is subject to several key parameters or guardrails. And specifically, it's not intended to duplicate or supplant other CalAIM funding, such as the IPP. And so it's really intended to be complementary, and that is reflected in some of the parameters that are mentioned in the oversight for this and for these initiatives. Next slide. So I just included some of the resources that I've mentioned in the presentation today. They're all listed here to facilitate if you would like to have some additional information. And then if you go to the next slide, I think that is the conclusion of my presentation. So happy to take any questions. And thank you for the opportunity to speak with you today.
Thanks so much, Sam. That was a really comprehensive, fast-paced, which I love. It's like a lightning session. It's a lot of information to digest for sure. And thank you so much for sharing that resource. I think I'm going to be tuning into that cited informational session later today, and hopefully giving myself a little bit more of an in-depth knowledge. And then I just want to turn to Debbie, who has her hand up, and hopefully Debbie's not feeling too spicy today. Go ahead, Debbie.
That level setting, Maria. Thank you. I'm not spicy. I was spicy in the chat, so you can go up to my spicy comment in the chat, Sam, but this isn't about that. I was going to ask, so if the collaborative, for example, or some other like a state association or something like that were to do an application for the cited PATH funding to act as a sort of a learning laboratory for community-based organizations, to provide community services. Like, so some of the issues, just briefly, that community-based organizations might have is that they don't know what the need is going to be in their community. They don't know how much they're actually going to have to ramp up, and how many staff they're going to have to hire, what kind of a margin they have to have, how it's going to impact their insurance costs. Like, there are a bunch of different things that we would need to know in order to build up to serve the members appropriately without bankrupting ourselves or harming the person. So like, I feel like we have all of this expertise in the service delivery space, but this is a new thing for us. So I envision the California Collaborative and statewide associations that for adult day health services, for example, that might apply for cited PATH funding to be able to support their members. Do you see that being a possible use of the cited funding?
So when you say support their members, how would you, can you specify more specify as to what you intend with that?
So let's just use an example. Let's just say that I'll just call it YOLO Adult Day Healthcare because I don't think they're in the room. But let's say that YOLO Adult Day Healthcare worked with CADS, the California Association for Adult Day Services, and they had put together, they had done a contract for ECM with Partnership, which is their managed care plan. And they had done all of this sort of grounding work. They had figured out how much it was going to impact their insurance. They had done a study of the number of members that would likely fit into each one of those categories. They had figured out their case ratios. Like, they had done some groundwork on it. and they worked with CADS to start developing sort of this best practices model. These are the things that you need to look at. These are the things you need to consider when doing a contract. These are the things. And then CADS then acts as that support hub for other sites who are wanting to apply for path funding to help them figure out what it is that they need to apply for and how to do that. Like that's kind of what I'm thinking, because membership of community-based organizations, many of us are working 70 and 80-hour weeks, and we're not, tracking on all the things that you all spend your lives on. And so how do we make it accessible to them through an entity that they trust, that has already done some of the vetting for them? That's my hope, is that, my overarching concern is we will not have managed care plans contracting with the community-based organizations that are the best ones to offer the services, because they're not looped into this.
Mm-hmm.
Does that make sense?
Well, yes. So I would say, the state has indicated several of the different types of activities that the funding could be used for. And they have said that it's not intended to be exhaustive. So I think there is a case that could be made, depending upon whether or not it does help to facilitate the uptake and scaling of capacity and infrastructure to support ECM and community supports. They also do, there is a provision which I did not include in here, but there is some mention of retroactive funding that could be used to pay for previous types of activities that were done to support ECM and community supports. So that is also another area of the cited initiative that may be of interest. And I think also, they're definitely for the cited initiative, they are specifying that you have to have a contract with or intend to contract with a managed care plan, recognizing that they really are trying to facilitate connections and collaborations with managed care plans. That is also, I think, partly why they're encouraging some of the conversations at the local level through the collaborative planning groups as well. So continuing these conversations, but recognizing too, not everybody is going to be ready to, be prepared for the round one funding and scaling and all those things that take time and effort and careful planning. And so that's why they've offered multiple windows, application windows, to be able to prepare for that.
I do understand that. And I just want to point out that the population that probably most of us on this webinar specialize in is the population that's going live in January. So it would really behoove us to be able to get our state associations and the California Collaborative prepped to support and do outreach so that we can get them and prepared to meet with their managed care plans. Ultimately, that's what it's all about. And it's all about getting the right services to the people who need them. So I just emphasize that it's important for us to get in on this first stage in order to be able to adequately serve people as they enroll that we specialize in. Thank you.
Thanks.
Thanks, Debbie. I appreciate your comments. I know the Collaboratives, CalAIM work group and some of our policy work groups have had this conversation about, is this a place where the collaborative can plug in, or statewide, associations can plug in? And there is an ongoing dialogue with DHCS about that opportunity. The impression that I get is maybe not on round one, but I think you make a really solid case for us to continue those conversations, because it is important to plug in. And given that our population is going live, early next year, it'd be nice to have that infrastructure in place. And I know that when I looked at the siting funded, just recognizing that we don't fall into the eligibility category other than the one that says as approved by DHCS. So there's that kind of level of discretion there. But I think for me, kind of falling in that bucket of evaluating and monitoring service capacity, assessing gaps, and identifying strategies to address those gaps feels like a really comfortable place for us. And I'm sure other associations can probably offer a little bit more, like increasing provider workforce, but I think the opportunity is there, and it's just about having that conversation and continuing to push that button and say, hey, we're here, we're ready to jump in, we're ready to help, let us know. And I'll be on that cited webinar later today. And by the way, Debbie and others who are on the call, DHCS did reach out and ask about our collaborative members who are also providers. And we did share a pretty extensive list of contacts with them. Debbie, you were on it. Leading Age was on it. Becky, CADS was on it. So don't be surprised if they reach out, maybe with a survey or some additional requests to you individually. So thanks so much. And then I did see a question in the chat, which now is kind of gone, but it was from Sherry about whether the collaborative initiative includes the establishment of a consumer stakeholder group that might advise the managed healthcare plans and contractors, as well as provide feedback on the implementation of CalAIM. Sam, do you have any insights on that? I faintly remember DHCS saying something about a stakeholder group. It was a consumer group that might provide feedback on CalAIM, but I think Sherry's comment is a little bit different from that.
Right. No, that's right. I haven't seen a consumer piece associated with the specific PATH funding, although I'm sure that will be a part of it when you're talking about these local on the ground conversations. But there is a consumer advisory stakeholder group or work group that will be rolled out. I don't quite recall the implementation timeline of that, but they are intending to have a statewide group be able to advise on implementation of CalAIM.
Thanks so much. Yeah, and I realize we're right at time. Just want to underscore, Debbie, you've got some support in the chat from Pat. As always, Sherry is cheering you on. Sam, thank you so much for a clear, comprehensive overview of this funding opportunity. And I hope that we can, and Debbie, yeah, I can send you the link. I have it here for the webinar opportunity this afternoon. But I hope that we can continue this conversation about PATH and the rollout of CalAIM, and just keep the dialogue open with DHCS as well as we move into this big initiative, which we know the vision for it is right on par with where the collaborative's vision is. But I think the devil's in the details, and this is a lot of work. So certainly any opportunities that we can leverage to support each other as it rolls out, that would be great. And of course, providing feedback and being kind of partners in this. So thank you all so much, Debbie. I promise I'll email you that link right now, and we'll see you all soon. Thank you.